and welcome to South First. I am Chetna Belgare. Stroke recovery can be a long and difficult journey. It's filled with therapy sessions, progress, and moments that actually test one's patience. But what if something as simple as playing games could help patients heal faster, stay motivated, and even enjoy the process? Today, we explore on how gaming is finding a surprising place in stroke rehabilitation. Joining us is Dr. Sindhu Vijayakumar, specialist in physical medicine and rehabilitation, with expertise in spinal cord injury care, prosthetics and assistive technology, pediatric and even cardiopulmonary rehabilitation. Welcome, ma'am.
Thank you so much.
My first question, ma'am, how soon after a stroke can someone start their rehabilitation journey?
Well, I would say as soon as he's medically stable, means his BP and blood pressure and heart rate is stable, the doctors have set him free from the ICU. So it could be started as early as day one if it is a minor stroke, and within 48 to 72 hours, depending. Some people may take a longer time for their vitals to get stabilized, but as soon as they're stable, they're able to stand for some time, they're able to engage, we start. So we've started from day one itself, and in some cases, day two, day three. Most of our cases, day second.
Okay. Well, it's very interesting that, because I've heard of a lot of rehabilitation programs, but then, and also it's very, very important for stroke recovery. But, where do games fit into stroke recovery and how can they actually help? Like, what are we talking about here?
Yeah, so when we talk about games, it could be as simple as a ball. Earlier people used to give balls in people's hands and ask them to press the ball. So that itself is like a stress reliever thing. But more than that, there are systems that have been developed recently in many of the startup companies. They incorporate a game into a screen and they give an attachment for an upper limb or a lower limb activity. So these are all similar to the games that we play on the phone. These are games of, let's say, catching a mosquito, killing a mosquito, or catching a ball. So such sort of games are incorporated into a medical rehabilitation device where they are giving a hand activity, an upper limb activity, say flexion, extension, moving the shoulder or the elbow. So they have incorporated that activity into a game. Okay. So by doing, they can get an exercise along with a game.
Okay. So when they're doing these kind of activities, which is already designed into this system that you're talking about, what kind of strokes are we actually talking? Like what are the different kinds of strokes that actually will help? I mean, these things will help in recovery.
So any stroke, I would say, any stroke would help. Mm-hmm. Basically, in stroke, you have weakness on the one side only. Right. So usually one side is paralyzed, either right or left. So the types of strokes otherwise are either it's a clot or a bleed. All these type of strokes can have, can be helped with a gamified device. Now, with one limb, when it is totally paralyzed also, we are able to give, because if we give an attachment, because that's the beauty of stroke, they have one side normal and one side is only affected. Mm-hmm. So if we can in some way attach the affected arm to the device, then with the other hand, they can play the game. So ultimately, they end up playing the games independently with the sort of some devices, like we give an attachment, a glove, things like that.
Okay.
Yes. What type of stroke?
Okay. Other than, when you're talking about this particular system that is entered into one device as such, but are there games like, for instance, badminton or any of the other physical games as well, which help in these things? Have you looked at, other than the space of rehabilitation center, but are there anything that you suggest that they do outside that also, which can help in recovery?
So most of the time we do suggest that it should not be. So basic thing in rehab is we teach them exercises. So either it's passive, like the patient is not able to do himself and the therapist or the bystander is doing the exercise. Then when they start recovering, it is an active assisted phase where the patient can do some movements, but they cannot do it all themselves. Mm-hmm. So they need help. So therapist is doing part of it, and the patient is also participating. and then the active moments where the patient is doing everything by themselves. So in all these stages, we always tell patients to engage in activities, because if these things are not extrapolated into real life, they will not be really benefited. Because after a stroke, you want new pathways, new nerve connections to be formed. Only then they will recover. So just doing an exercise 10 minutes a day or 15 minutes a day will not work. You need to do it multiple times. So what we otherwise also we tell them to do these activities outside. So we generally tell them to do activities of daily living. When a person is lying in bed, one side paralyzed, you tell them to play a game, they may not really be able to do that. They may not be able to use any other toy or a device. With kids, it's much easier. Yeah. But for a person, you might need something like a structured, a device to do this. Other things are like we have therabands. All this will help only when patient is partially recovered. Okay. So outside of these kind of systems are a little bit rare, or not that I don't know much about, but there are exercise devices, or these are all therapy equipment basically.
Okay. So can games actually help patients regain movement and strength more effectively than traditional therapy alone?
I must say yes, in those patients who are willing to try it out, but there may be some people who do not want to try it out. But mostly what I've seen, like I did not think too much of it, especially in the adult population. I was only thinking when we started off with this, it might be more so useful for the kids, younger age people. But surprisingly, I found that most older persons, middle-aged persons, all of them kind of like it. I think the main reason being doing an exercise in the traditional way, doing the activity in the traditional way, there is too much stress, like, oh, my hand is not recovering. But the moment you change it into a game, the attention is taken away from the fact that they are doing an exercise or that they are being paralyzed to that goal or the achievement that is to be done. So there's a target and you have to achieve that target. You have to go and move and touch that target. So the attention is totally deviated to chaining that goal. Okay. So therefore, I feel people are much more engaged and they don't realize the strain of doing the exercises. And once you get into that, then, obviously when we start a game, then you want to win it.
So, I agree. So, do these games also help with memory, like focus and even emotional recovery does? Because, you're already paralyzed on one side and you are emotionally also low, right? Like you said, my previous question probably connected.
Exactly. So I just ahead of this interview, I was just asking my therapist, like, is there anything you want me to tell? So they have given me an example of a particular person. He's in his late 60s, early 70s, and he was kind of depressed, not talking to people, and then started him off with these kind of games. And they're saying he actually started speaking to them, and he found a goal to be achieved, and then they were very impressed with the fact that only because they use this, that he has been able to come out of the depression. Now he has something to look forward to. Right. Another thing, what we are achieving here is that within a span of around 3 weeks or so, from a zero power. So when the power is zero, we, as I said, we attach to the device and we use the other hand. So I always give bimanual activities, let them play with both the arms. Then slowly as they recover, we allow them to play with one hand alone. So that with the attachment, then slowly without the attachment, holding it on their own and doing it. So this much of activities can be achieved within a span of 2 to 3 weeks. So which is very significant. We generally say the upper limb recovers much slower than the lower limb. But this is something. So when they see that, like yesterday I couldn't do it and today I can do it, so that really boosts up the morale, boosts up the emotional status along with the recovery. The actual power is.
Yeah. So can these games be actually tailored to suit people with mild versus severe strokes?
Yes. So if it is a very mild stroke and they already have the power and I only want to strengthen it, so we add activities according to that. So most of the games are like that, and we can add resistance to or difficulties to the level that they already have. So we generally choose the games according to their functional status.
Okay,
Yes.
okay. And how many minutes or, what is it like, ma'am? When they come for a rehab program to you, then
Yes.
is it like timed differently? How does it work?
Yeah, so I have in my center we give a minimum of 20 minutes because the first few sessions they need to understand the game slowly, they have to do it. So the minimum slot is around 20 minutes and the maximum we can go up to 40 or 45 minutes or even 1 hour. But due to time restrictions, because we have to serve so many people, the usual timing either per session is either 20 or 30 minutes. And to
And
some people, twice a day, because if there are admitted patients, we do these 20 minutes or 30-minute sessions twice a day. So that reduces the strain of exercises, but at the same time, it increases the number of repetitions, which is very helpful for the brain. The brain needs a lot of repetitions for the pathways to form.
right.
So, yeah.
So can families or caregivers use these games safely at home? Like, can they actually do that, or do they have to come there to?
So at present, I think they may have to buy the device if they have to use it, because these are not technically, because the attachments, the exercise part comes, the money is where the way the device is designed to give an exercise. So the table, there are bilateral handles and there are different handles. You can do different activities with it. There can be a writing game, they can do alphabets, they can do cross matches, they can, as I said, by killing the mosquito. So any activity can be done. And the handles are also of different shapes and sizes. So that is the money part. And
it's better to come there and do it, is what you say.
Exactly. Better to come. And these are all supervised sessions.
Okay. Okay.
Once the public is there, they can probably do similar activities at home.
Okay. Okay.
Similar activities can be.
So what is your one piece of advice for stroke survivors looking to make recovery? How do they make it more engaging and hopeful, ma'am?
So for stroke, the key is time. As soon as you start rehab, the best.
Okay.
And persistence and the number of repetitions. So these are the three major things. People do like 10 times a day, it's not going to recover. And you do once a day, just 10 times, the neural pathways, new pathways are not going to come. So you're reteaching the brain, you're creating newer pathways, and whatever the damaged part is not there. So start as early as possible. You do not wait for weeks or months to start stroke rehab. Stroke rehab should be started as early as possible. Plus, all the one tendency we have in India is to support the person. We love them, we care for them, so we feed them, we
don't let them do anything on their own. Yeah.
So that is the biggest harm I see for people with strokes. These kind of games, even the parents or the relatives can understand, oh, they're able to do this, then maybe I need not help him with this. So if you really love them, do not do everything for them. Let them use their extremity as much as they can. So these are the two things that they should understand and that they should practice. And those who are trying to do so, we all see this difference. Right side improves much better than the left side, because left is the non-dominant side. We don't use them even otherwise so much. So if that side is paralyzed, then the recovery is much slower. And without the right, we are not able to do many things. So these things that we see, trivia that we see in common practice.
Right.
And I must add that these game-based rehab is not just for stroke patients. I use them for a wide variety of neurological as well as musculoskeletal conditions, injuries, and all that. So wherever there is, say, balance issues, coordination problems, not just weakness, there is an injury to a shoulder. In all these things, we are using similar devices, and we are, finding good results with that. So,
great.
Yeah. But most of our patients are stroke patients.
Okay. Thank you so much, Dr. Sindhu. It was wonderful speaking to you. So all of the caregivers of patients with stroke who've suffered from stroke, and even they themselves, please ensure that you reach rehab centers early and then do not wait. And also, I know that caregivers do love their family members, but then please make sure that if there is necessary, if there is need, do it. Otherwise, if they can manage to do it on their own, then I think you must let them do it for a faster recovery. Thank you very much, Dr. Sindhu. It was wonderful speaking to you.
Thank you very much, Shirley. Nice speaking to you.
Thank you.